Okay, thanks for coming back. It's Rebecca Gordon with Gordon Marketing, and this is video number 2 on my most commonly asked questions on the Healthshare Ministries. We rolled this plan out, in April or May of this year. It's been a really great ride, very interesting concept. I like them. I like them for the right client. So again, hopefully you've seen the first video. If not, watch the first video. Don't come in on the second video. And these are the questions I get all the time. So my next one is, when are the contributions drafted? Your draft date will always be the first of the month. In fact, your effective date for these plans is always the first of the month. So if you enroll someone between the 1st and the 25th of the month, you'll get the 1st of the following month. And if you enroll someone the 26th to the end of the month, it will be the 1st of the following month. All right, so that's your effective dates. Contribution draft dates are always on the 1st. Do they use a network, and are there any out-of-network charges? Yeah, that's a huge strength behind Healthshare Ministries. It really doesn't matter who you're using. Providers will always look at a Healthshare client as self-pay. So right off the bat, if you're self-pay, if you're deemed self-pay, we always get a lower rate. I mean, that's just universal. I've done my own legwork with my own facilities and hospitals and doctors here in Indiana, and they ask, do you have insurance? If you have insurance, it's this rate. If you don't, it's this rate. So they look at you as self-pay. Altrua uses the PHCS network, which is a national network, and there is only an out-of-network charge if you go to an out-of-network doctor, and then you're paying 50%. You're paying 50% of the bill. That's how that works. Otherwise, everything is in network. So if you go to PHCS doctors in network, you're great. And there is no network for the hospital. Everybody's in, and you get all the repricing that there is, all the benefits. Now, Altrua's leadership, where do they come from? They owned a medical repricing company, which was really attractive to me because I know the power of repricing. I know that when you have a strong network and you take the bills and you run it through the network machine, it can just carve out a bunch of fat. And for these plans to be successful, you have to have that skill set. So this company is based on already the talent of negotiating bills, and they're fantastic at it. So that's why you do have to pre-certify. That's why they want to know what's going on at all times so that they can be jumping on and start the negotiations immediately. But with regard to doctors and hospitals, they do use the PHCS network. It's a huge national network and has really been a benefit to all clients. Do they recognize common law marriage? This was a question I just had recently. And they will recognize common law marriage as long as the state does. So if the state recognizes it, then they will recognize it as well. They'll follow the state. Do I have to be certified? Yes. So we do training and certification every Friday in a webinar, or you could attend some of our meetings. But yeah, you got to be certified. You got to take a test. You have to pass the test with an 84. And again, I like it because I want people who are really going to take this plan seriously to really know it inside and out, to know you have to use certain language, certain lingos. You don't get cutesy and bleed over and start talking some major medical talk, because that just screws up people. And if we start to screw up our clients, we're going to get complaints. And if we start to get complaints, then something this good gets on the radar, and we don't want that. So we do that. If you need to get certified, shoot me an email, Rebecca@Gordon Marketing, and I'll make sure you have all the information for our next webinar. When can I sell? You know, that's one of the biggest selling features to these plans. Sell them all year long. There is no SEP. There is no open enrollment. And so what we're starting to see right now is people are calling me and they're like, hey, you know, this could be a good fit for a client, but they have an ACA. Can I cancel it? Should I wait? You know, I'm the believer of if you can save somebody some money, do it. You can enroll them at any time. Obviously, we think this open enrollment is going to be really, really, really big because there's hardly any competition in the market and the rates are so astronomically high that client base that we're all going after, that 50,000 and up, right? That's that sweet spot of the clients we're looking for, 50,000 and up, they work. They're going to go without insurance unless they have another option, unless you give them a recommendation. Sell all year long. Do I have to be a certain faith? This is huge. So, really, this was one of the big hard no's for me in looking at a plan like this, because I did not want a Bible thumper thumping, telling me that I had to be a certain faith, telling me I had to do this. I didn't want that. And so what attracted me to Altrua is that they operate off of a statement of standards. So they have a couple things that are their standards that you have to adhere to. And that's fine. They're spelled out. They're not a big deal. But they take all faiths. You could be Christian. You could be Muslim. You could be Jewish. You could be Buddhist. You could be anything. You could be non-practicing. But you have to adhere to their statement of standards. So I do like that. You do not have to be a certain faith. You do not have to have a pastor get involved and sign off. That's not what they're about. The sharing concept is universal. People put money into their escrow account, and then as needs arise, those needs are met, right? Money comes out and pays for those needs. And they're going after folks who are like-minded, who are taking care of themselves, who watch what they eat. They get their preventive screenings taken care of, right? They're getting their PAPs, they're getting their mammograms, they're getting their colonoscopies. They're on top of their health. Because people who have that mindset typically are lower utilizers. They're going to be a certain income and education level, absolutely. Someone who seeks out a Healthshare or buys into a Healthshare, that's the type of client we all want. They're going to be middle to upper income, middle to upper education level. They're not going to be the 100% subsidized folks that have their hand out just wanting free insurance. And then, oh, by the way, I'm not going to pay my bill. Even though my bill is only $5, I'm not paying it. And that's what Obamacare really created, was this toxic pool that agents were spinning their wheels trying to help these folks because it was supposed to be easy, and it wasn't easy, and it's hugely unprofitable. But people are, still calling us, so it's toxic. So someone who is interested in a Healthshare, I'm telling you, upper to middle income, education level is going to be there. It's the right person. Typically, they're going to own something, right? They're going to own their home. They're going to own something so that if, God forbid, they got hit with a massive need or claim, they wouldn't lose their shirt. They wouldn't lose their home. So these are really great to me as a lead source because it's putting you in front of the client you want to be in front of. So no, you don't have to be a certain faith. Do they cover prescriptions? So what they all typically have, and I'll speak specifically on Altrua, is they're going to have some type of a generic program. Now Altrua does not have a copay per se, but what they do have is they have partnered with a prescription company called Magellan, who gives out very deep discounts on drugs. So if I was to go to Walmart, which historically has the lowest price drugs universally, I give them my Healthshare card, and they're gonna say your drug is $5. Now the real cost is $5 because I don't have any copays. But because I'm working with Magellan, there is about a $2.90 fee for me to get that big discount. So what Altrua is doing is for the first 3 meds per person per month, they are waiving that Magellan fee. They're actually paying it themselves. So the prescription benefit is this. I'm still paying for it out of pocket. I'm paying for it, point of service, but Altrua is covering that fee that Magellan's going to charge to get that deep discount. So it's the first 3 drugs per person per month. That's the prescription. I've never seen a Healthshare ministry that covers a brand name drug. They don't do it. So this is where you have to do a little math. If I'm saving you X amount by looking at a Healthshare versus an ACA, then, you know, take your savings and pay for your drugs. If I'm on a lot of brand name drugs, I'm probably not going to qualify for the Healthshare. So I've seen several situations where one family member stays on an ACA because, you know, they might be a little bit higher utilizers, and the rest move to the Healthshare. That's fine. You can do it either or. All right, we're going to stop again, get another drink, and we're going to come back to video number 3 on the most common questions I get.